And we're ready.
Good afternoon, everyone, and welcome to Education in Our New Reality, a conversation with community leaders about school reopenings. And today we are in part one of a three-part series. So thank you all for tuning in, and thank you to One Voice in our Mississippi State Conference of the NAACP for sponsoring this. So I want to begin by just thanking each of our guests for being here and agreeing to share their wisdom and their knowledge today. And let's do introductions, and we can start with the Reverend, and then Dr. Eudora and Scott. And tell us, why are you here, and tell us in what capacity are you here today?
Well, good afternoon, and thank you all for one, hosting this forum and creating this space, and two, scraping the bottom of the barrel and inviting me. I am pastor of St. Paul, St. Elizabeth, United Methodist Churches. Both churches are in the city of Meridian. Also, I serve as the president of the Meridian Lauderdale County branch of the NAACP.
Good afternoon, and thank you so much, Miriam, for having us. I am Aisha Yanduro. I'm the Chief Executive Officer of Springboard Opportunities. Springboard provides programs and services for families that live in federally subsidized affordable housing. We work in 3 states, Mississippi, Alabama, and Maryland, but specifically in Mississippi, we are in 6 multifamily communities, working with about 1,200 school-age kids and their families each year.
Thank you so much.
Good afternoon to everybody. And again, thank you for the invite. My name is Kiva Scott. I'm CEO for the Boys and Girls Clubs of the Gulf Coast. We have 6 clubs along the Gulf Coast. We're an out of school program for those who don't know about Boys and Girls Club. We have a full-time summer camp every summer, and then we serve in the after school. So we like to say when school is out, the clubs are in. 6 clubs along the coast. We serve about 1,200 pre-COVID. We served about 1,200 young people each day, and over 5,000 in the year.
Well, thank you so much, Reverend Boger. Thank you, Dr. Eudora, and thank you, Ms. Scott. So today we will have some questions about school reopenings and how we can support our communities. And we'll also, near the end, open it up to see what we get in our Facebook live stream chat as well. And so you all feel free to jump in as it relates to you, what you're doing when I ask the questions. So I'd like to begin with, what do you all think should be done to keep our children safe? And what have you all been doing, or what do you think should be done in the form of a community-based effort, in the form of community? Because we have been hearing so much about, parents who still have to work. We've been hearing about, families who need food. So what do you all think should be done as a community, and what have you been doing? And who would like to go first?
Well, I can go. We made the real tough decision not to have our traditional after-school program. Like I said to you, we serve a lot of kids on the coast. We're the largest provider on the Gulf Coast, and lots of families, lots of parents depend on us. The schools, school partnerships, when kids get out, having a safe place to go so that they're not home alone, they can get homework done, social interaction, all of that. One of the things I was concerned about, though, is the timing of us going back to school. Here on the coast in particular, Mississippi in general, but on the coast specifically, the cases are actually rising. And so, we closed schools when we had less cases. Schools closed down. And so now that they're rising, I'm concerned about them going back, obviously, and I understand the reason for going back, I support the reason for going back. It's just a timing thing. And so for us, if kids were social distancing in the schools, then they would mix on the bus, and then they would get into the club and mix, because we have in one city kids coming from several different schools. And so that was a concern for me. So what we did offer, to your point, a lot of parents got to work, be able to provide for their families. And so we offered what's called a virtual education hub. And so we're lucky enough to be able to have a club in every school district. And so those clubs, for the parents that have chosen a virtual option, will be an opportunity for them to drop their kids off to the club. This will hopefully fan kids out, a little bit more into the community, so the class sizes aren't so large. And we have computer labs, we got 5 clubs, well-equipped facilities. And so this is an option for those parents. So you can go ahead and go to work, our class sizes are smaller, 8 to 10, kids per room. There'll be no mixing in the halls. The foods are, food will be delivered to the classrooms. And so that's our one way to be able to, try to help schools and parents be that bridge. We all want kids to be educated. That's not a question.
Exactly.
We're all concerned about young people that have been out of school for 5 months and hadn't had formal teaching, right? But it's the timing, and that's my biggest thing.
Thank you.
I guess I can tag in next. So when we talk about what are we doing to keep kids safe, I really think we have to operationalize safety. Are we talking about physically safe, or are we talking about emotionally safe? Because there are a plethora of needs right now when we're talking about kids and what it is that they need. As it relates to physical safety, yes, we know that supporting the schools and their ability to provide PPE or social distance or do virtual or hybrid learning, supporting those decisions and those efforts, and really recognizing that there are no easy decisions right now. So as community partners, how do we really just help fill in the gap and support our local districts and educators? But then also, if we're talking about emotional safety, for a lot of the kids that we work with who live in extreme poverty, we know that isolation and that ability to have connections it's needed and it's real. And so when you go to a virtual world where you are, closing schools, that is setting those children up for a plethora of other challenges as well that, we probably really need to start having conversations about sooner rather than later. I know right now the immediate need is the physical safety for these babies, but we also, right behind that, we really do need to be talking about the mental health, pandemic that is right around the corner for these kids. And then also the widened education gap pandemic that is right around the corner after that. But, just in the interim, if we're just really addressing the very basic, how do we address the physical safety of kids right now and what that looks like? I really do think it's everyone showing up and trying to be innovative and thinking differently. I love what Kiva was saying that they're doing on the coast. We're transforming some of their classrooms into learning spaces. So where individuals need to go back to work, have that opportunity to drop their kids off. With Springboard, we provided virtual summer camps for our kids this summer on site in the communities that they live in, because, we had to also make the very difficult decision to not run summer camps, because when you're talking about affordable housing, which is the space that Springboard operates our programs and services in, it's dense. And so it's very tight, confined spaces, lots of babies. We operate out of a community room where we don't have the ability to make sure that 50 kids or however many kids show up for summer camp are staying 6 feet apart.
Right.
So we made the difficult decision to go virtual, and that's a learning decision for, a learning curve as well, because, all of us are doing Zoom and we adapted really easily to that platform. But that's a learning curve. It takes some bandwidth to say, okay, let me jump onto Instagram Live or Zoom or something to get some programming and services. But then also, the other piece that we're continuing to do to make sure that kids are all right and are safe is making sure that babies are continuing to get fed. So we are partnering with our local school districts, with our local churches, with our other local community partners to make sure that there are food boxes delivered in the communities weekly, making sure that there are daily meals for breakfast and lunch provided to these kids. And so we just all are going a little deeper right now, which, in the midst of everything, I will say that has been some of the beauty that has come out of Mississippi and out of this country, is just seeing how partners are really willing to dig deep and stretch in order to provide individuals the grace and support that's necessary right now to get through these very challenging times.
Oh, thank you. That's what's going to take digging deeper. And I want to say thank you for mentioning mental health. I've been in several teacher support circles, and the main concerns expressed were the students and teachers' mental health. What are we going to do about that? So thank you for raising it, Dr. Dora. Thank you. All right, Reverend Boger.
Yes, the Meridian Public School District as well as Lauderdale, both are faced with very challenging decision, matter of life and death. So as of right now, with the Meridian Public School District, they have kind of made a split. So they are making an opportunity for online virtual learning, of course. And as of actually today, the school board has voted to extend the face-to-face start into September. And so I think one of the things that the school district is doing is providing options. And I think that is a way of, instead of dictating to the parents per se, this one way or the other. I think one advantage of this decision is to place it in the laps of our parents and give them that option to choose what's best with those two selections, what's best for their family and their family circumstance. Also, with that, there are some conversations. I think this is one of those times when the community is given an opportunity to step in and partner, and both Lauderdale County and the Meridian Public School District have made themselves available for community partnership. And I think that is some of the ways in which we can work together to find innovative ways to keep our children safe, as well as educating them. One of the things that I'm hoping that we also focus on or pay attention to is our educators. And that's a concern of mine is to ensure that we are adequately engaging in these conversations with the educators. The educators are doing their part with preparing themselves for this new landscape of education. But I think the language, understandably so, we are focused on the children. I think that we also should look at paying attention to the voices of our educators in this whole scenario.
Indeed. As an educator myself, I've been, trying to do my best to follow everything in the news. You see strikes across the nation. You're seeing and hearing so much, and some educators do feel unheard. But with that being said, and considering everything you all said, we know the students need food. We know they need their education. We know they need mental health care. There are so many needs that we just identified, and you all are doing such amazing work. So what can we do as a community to continue to advocate and support you all? Like, how can we advocate as a community? What you all suggest, or what has worked in the past to advocate and support what you all are doing?
I think that and I guess again, I'm just continue to speak on my context. That's the Meridian and Lauderdale area. One of the things that's vital, and it's starting to take place now, is identifying resources. I think that what will definitely help the school districts and help the parents is compiling resources and making them accessible to our parents and school districts. Resources such as right now we have the East Mississippi Boys and Girls Club. Of course, they have a resource available as it relates to technology as well as providing food. But there perhaps can be the faith-based resource, churches that could serve as hubs for not only, again, the technological part, that is for those parents or those families that don't have access or adequate access to internet. And then also there are faith communities that can provide resources for support with lunches and other support. So I think that, at least for our dynamic, making those resources available and accessible, identifying those resources are available would be helpful.
Thank you.
I think one of the pieces, definitely with that, what the Reverend was saying, but I also think we need to continue to be open to listening and learning, and recognizing that in this space, no one has the one answer. I don't know anyone who is working right now who has ever lived during a pandemic. And so, with that said, there is a lot of learning that has to happen. And so, there's opportunities for those of us who are experts in certain spaces to definitely lend our expertise, but then also there's an opportunity for us to listen and to continue to be open to the magic of listening and the innovation that may occur. And, I'll say this again, I think we all are going to have to be willing to stretch and learn new skill sets and think more innovatively about what's necessary. Because, as you said, Miriam, there are so many needs. No one partner can address all of the needs, but how do you make sure that in the need that you are called to address it, you're making sure filling in that gap? And if there are other gaps that are there for your population that you're serving, don't be afraid to pick up the phone and try to establish a strategic partnership, even if it may not have been a partner that you had previously, because everyone is really trying to show up and really make sure that we all get on the other side. A few weeks ago, we were like, oh, we're all in this together. We're all still in this together. Corona, just because outside is back open does not mean Corona has gone back in. So we all need to continue to govern ourselves with that same wisdom of being in this together and needing to support each other.
Thank you so much for just reminding us the importance of those strategic partnerships. Please partner and get together and advocate. Thank you.
I want to jump in before my sister does just quickly, since I'm the minority on the panel. But I think what was mentioned is really key here in terms of the listening piece and recognizing that no one alive today has been through a pandemic. And so it really is going to take a great deal of grace with the grace from the parents and communities, as well as grace from the school districts. And we work together, and so that recognizing that what we put forth as a possibility the first time, it might not work, but grace will allow us to go back to the drawing board versus, a barrage of criticism that would, destroy the whole possibility for our children to have successfully navigate through the school system or school year. So I agree with you completely. I think we keep our ears open and have grace with one another, because we have not, this is totally new. And in the words of your president, we're in unprecedented times. Can't believe you were so.
Thank you.
I'm sorry, go ahead.
Well, listen, not much more than what you guys said. I think the only thing that I will add is that, and it comes out of what you guys mentioned, and that's grab these best practices. Be able, what worked for you? Okay, well, what worked for you? One of the things that we knew that would work for us real well, because we actually, when the pandemic hit, we still kept serving. We were able to jump up real quick and get food out because we have, an after school program. So we were able to feed kids until the schools had a chance to get staff back in. It all ended abruptly. And so I think work together, knowledge share, tell people, what's working for you. We knew that small spaces were working very well for us. We did an essential program where we took care of the kids of essential workers who were on the front line. And we just took those best practices. We knew that that's what's going to work. And then the other thing is to you guys' point, this is not a competition. Nobody's trying to, that's not what it's about. If again, we started with, it's right for children to go back to school. It's the how and the when, is the thing. And so for us, of course, we could push forward and have our after school program, or we can help the district get kids, connected with their teachers and stay in their district where their tax dollars are. That was important.
Right.
And so I think all of that, being humble, best practices and knowledge sharing, is what I feel is going to get us through.
Well said. And one of my colleagues reminded me of what you all said. He told me this is everybody's work. This is just not her work, his work, their work. This is our work. So well said. All right, so next, I wanted to ask you all, we know the state legislature allocated federal COVID-19 relief funds to MDE to expand remote learning and to purchase protective equipment. And do you all think there has been an adequate response from elected officials to ensure that the children have the resources they need during this new reality? And we can start with Dr. Yandora.
So I think the adequate resources, not going to be speak negative of anyone working really hard to address the needs right now. So I think making sure that children have access to technology, hotspots, PPE, if they are going back to class, I think all of those pieces are important. But I also think that's just the top layer. I think you also have to go a layer under that. So if you are working in a low income district like JPS, where the majority of the individuals are working, essential families, you can have a hotspot, you can have a laptop. But if I am at home by myself, who is making sure that I'm doing my work? If I am at home and I am now the caregiver for my 5-year-old sister as well, who is making sure that we both are doing our work? So, I think that we have checked the box on that initial, okay, let's make sure we have our technology, shared up, which we did not quite have in March when all of this stuff happened. So I think kudos for us in doing the work to get that done. But now we have to take it a step further. How are we supporting these children who will be home by themselves in virtual situations to make sure that they are actually have the support to do the work? How are we supporting these children who, even if their parents are at home, but may not have the ability to help them do the work as well? So, are we thinking innovatively about what the school day looks like? It may be where we say, okay, teachers, you now operate as nurses. You have a day shift and a night shift, recognizing that these parents are not on all 7 to 3 or 8 to 3 schedules. So I don't really know what the answer is. Like I said, I think everyone is definitely doing the best that they can with the hand that we've been dealt. But for the sake of all of Mississippi's babies, particularly babies who live in these low income communities, primarily communities of color, I would like for us all to dig just a little deeper to make sure that they're not the ones who are left behind.
Well said. Well said. Thank you, Ms. Scott.
Yeah, I think when we talk about adequate, we don't know. I agree that there's respond, stabilize, and sustain. I think we've done a good job with the response. I think we're in that stabilize. I think that's going to take us a minute. This is not a sprint. This is a marathon. We've got to figure this out. And I think that we need to be patient with ourselves. And I mean, as a country, certainly as a state, where our sphere of influence is that, who says that we're not going to get back up and relax. We can fix all of this. If we end up partnering together, it's to the degree that you want to partner. If you want to stay in your silo and check off your boxes, done. Yeah, sure. You're going to be extremely frustrated because we're not in that. That's not the lay. That is just not where we are right now. And so I think that, let me give it for instance. And so we have some schools that responded very well in terms of equipment, getting their teachers ready, creating great trainings for when, students either come into the classroom or when they get virtual. But to Dr. And I don't want to mispronounce your name, so I'm going to call Dr. Sis for right now till I get that last name right. So Dr. Sis said, if you're at home by yourself, because your mom had to go to work, not because she's out kicking it, right? That's not the story, right? Because she had to go to work and she's calling back trying to wake you up, like this, at work, so that you can get your sister up and both of y'all can get up to some computers. And so you got an 8-year-old trying to navigate the house, or a 12-year-old, or even a 14-year-old. So did the schools do a good job of preparing? Yes, is the answer to that. Is this gonna work seamlessly? No, is the answer to that. You know what I'm saying? So it's not, not pointing fingers at the schools. I think schools are doing the best that they can. You can't get prepared for what you weren't prepared for, period. It's gonna take a minute. you know, and so while there are some that responded very well, even in their great response, if I'm choosing virtual, it's a different situation for me. And parents get to choose virtual if you're afraid. So, you know what I'm saying? It's a mixed bag. So I could definitely say, yes, I think they've done a good job. Is there more that needs to be done? Of course, but we got to figure out how does that now translate into a home with babies who have to help themselves get through the day. And parents who are terrified, you know, to send their kids, and with good reason.
Yeah, I would agree. Schools have had a great response based upon what they've been given. But my focus and our focus is more of the legislator and their response. But we can come back to like, what hasn't been an adequate response from the elected officials. All right, Reverend Boger.
That certainly is a concern of mine. For example, you know, we realize that there's a large segment in Mississippi of the rural areas where the broadband internet service is poor. And now I do remember here recently there was something proposed to expand access for broadband and to increase and improve access across the state. But again, that knowing where we are right now, what's ahead of us, I think that the elected officials that should have been on the table prior to this. I mean, I think that so in that regard, if I had to give a grade, I don't know if I get a good grade to our elected officials at foresight. And I don't even think that's foresight. I mean, we were in the thick of the COVID virus, and as legislation was taking place, I think they should have put on their mask and then put on their thinking caps and thought ahead about increasing and strengthening the internet across our state, particularly with the rural areas. There also the funding is supposed to come down the pipeline for PPE and for other technological advancement. The proverbial question, where the money at? When is that going to take place? And are districts seeing that? Or is that something that's in the language? Because I'm basing that, kind of making light of it, but the governor vetoed a significant aspect of the bill that would help in the area of education. And then when calls were made, I was one of many who were making calls to have Congress get back into do a special call session to address that. And seemingly it's been brushed off. We're waiting for them to recover from their careless acts in the first place of not wearing masks. So I don't have a lot of confidence right now. I typically am not a voice of pessimism, but right now I don't have a lot of confidence. And now I do know that there are some. Let me make this clear. There are some that are advocates for ensuring that our school districts have adequate resources and technology, et cetera. But as of right now, I don't have a whole lot of confidence. And that's where we as a community, we need our elected officials as partners. We need our community to voice so that we put some fire under them they have a key role in ensuring successful navigation of our students through this pandemic.
And key word.
I'll dovetail on that real quick just to say, to your point on the elected officials, I know of several that are here, local and statewide elected, that are doing a good job, that they're fighting the good fight. They are trying their best to hold school districts accountable. And, I know Sonia Williams-Barnes, for instance, has attended, school board meetings. As a matter of fact, Sonia Williams-Barnes was one of the first ones to come with us when schools ended to help us with kids in Gulfport in District 119. And so I think that they are fighting. To your point, I think more can be done. The only thing that I'll add, now I agree that, we've been talking about broadband since, for a while now. Like it's, and any other area in any other state, it wouldn't be this big debate. We know that. But I think that we've got to push them, the elected officials, more and not forget what's happening right now as an example for us to be able to say, because we don't know what's going to happen. So it just makes sense, as my grandma would say, to just do right to begin with. If it's right to have broadband, then let's get broadband in Mississippi because it's right.
Right.
And we have received the funds for it, so let's make sure we're paying attention and it will get put to use, and those who need it will be able to have access to it. That's important. So I would like to know, what concerns have you been hearing from the communities that you serve? What have been some of those concerns that have been communicated to you, where they came from? Parents, students, church members? And we can start with Dr. Yandora.
I think the concerns that we've been hearing are really the concerns that we've been lifting up here today. Is it safe for kids to go back to school if schools are open? If it's virtual, how are families supposed to navigate virtual reality when a lot of families still have to work? We cannot dismiss the fact that Mississippi is a poor state, and we are a poor state with a lot of essential workers and a lot of frontline workers and a lot of individuals who are only making $7.25 an hour. So what are they supposed to do about childcare when schools are not open? So, those are the main concerns. Childcare, I have to work, schools are closed. I can't quit my job because then how am I going to feed my family? If I find a childcare, how do I make sure that my child stays safe in that childcare facility? How do I make sure that my child is not further behind in school this academic year if they are at home for the majority of the year, if they are in a district that's not going to be in person until January as of right now? So there are enough concerns to go around. It's the reality right now. And, I think it's like we've been saying, I just think it's really continuing to lift up the concerns and make sure that the concerns of the loudest individuals are not the ones who are not the concerns that are always addressed. For a lot of individuals who are low income, they may not quite know how advocacy works. They may not quite know how to go about advocating for themselves and making sure that the needs of their families are being met. So for those who sit in these seats of leadership, who really have the gift of being the gatekeeper for a lot of these communities, it really is our job to make sure that we're advocating, making sure that their needs are being heard, and making sure that that information is filtering back to them as swiftly as possible.
Thank you.
The only thing I'll add to that is, we've been talking and, teachers is, we thought about it just today. We were brainstorming on some things, and was talking with our local hospital here that's working with us to, get some policies in place. Well, some things in place when we open up next week. But if a teacher goes out, and has to be out for 14 days, what happens to that in-house classroom? Was that look? And so, just praying and lifting up our teachers, and who are really, who have now become the frontline workers, right? And so, and just encouraging them, and wanting them to just keep pushing on, because it's it's a brave soul to be able to go in, because we just don't know enough, and the fear is real, and the fear is okay to have when we look at the full context of what we're dealing with. But that was one thing that bubbled up today when we were talking. I was like, it's a real good point. Will you be able to get a sub? Because some of these things have hit, like we got, we have the new $1 trillion bill that's about to be for unemployment. And so what we were talking about is, are you going to be able to get a sub? If people have now found themselves on unemployment, and in many cases making more than they had ever made, and in some cases more than they had ever hoped to make, with unemployment, how are you going to be able to get that teacher replaced in that school?
Well said. And that question, it keeps coming up among me teacher circles, and unfortunately, it's one that's tricky, but it needs to be discussed. And hopefully, the more it's discussed, maybe some solution will come out of the discussions. Reverend Boger.
Pretty much echoing the sentiments that have already been shared. I think the only additional, and it's been said in a different question, the mental health piece. So I kind of cheated a little bit and went to the WTOK posed a question, and whether or not schools should open And so I went to the comments section and made some notes. And so
Mhm.
some of those responses were pretty much what has been already said. But a couple stood out, and then one of my own. I'll just use one that stood out was addressing a concern of those students who don't have a healthy home life.
Right.
And the concern with the virtual learning and how that affects those students who don't have a healthy home life. And then also, I guess I would further that, not having a healthy home life. And of course, that affected pre-COVID, but it's exponential now. It's really a magnifying glass put on it right now with this circumstance. And personally, quickly, I'm hoping that a concern of mine on in the larger scope is that I'm hoping that we're not focusing so much on the immediate response that we are ignoring the possibility that this is life from now on.
That's right.
And I think that we're going to have to, or hopefully, I should say that, hopefully we are channeling our energy in not just temporary solutions to get us past one semester or one school year, but hopefully we are, collaborating or putting things in place that will be sustainable and from a long-term perspective, because as already mentioned, our sisters mentioned, this is not going away anytime soon.
Right.
And I think that in our resources, our partnerships, there's a wealth of innovation between our partnerships where we can put something together that will be a long-term sustaining. And let me say this, y'all remember I'm a preacher, so I always got to have at least 3 points. This is, I also believe that this is an opportunity for the beloved community to really be who we say we've been over the years. There's this idea of Sankofa where we look back in order to go forward, and the strength of our communities, particularly in the area of education, is when the dependency was not solely on the school system. The dependency of educating our children relied upon our system as well as our home life and our community. It took a whole village. And so I think that I think that there are some districts that are considering that. But again, I'm hoping that we don't ignore that it truly does take a village to help us get past this, not only get past this pandemic, but sustain ourselves to adequately educate our children, our future in the years to come.
Thank you. And when I think about the work that you all are doing, when I think about how we emphasize collaborations and partnerships and community, I picture, community schools popping up in order to support the parents and still support the public school system and support, the students. That's what I picture. Like, if we're all going to work together, if we're going to communicate outside of our silos, if we're going to work with the districts and still keep the kids safe physically, mentally, intellectually, then there's a great opportunity for us to, within the communities, have community schools and still support the public school system and ensure the kids are safe. So just everything you all have said made me think of that. Everything you said according to the work that you're doing. And earlier, you all mentioned how you had to, change some ways you function to serve students this summer. And so thinking about the fall, and, the school being right around the corner for most, and some have already started, what supports are you all going to try to offer to assist those students who are going to be engaged in online learning? I know you were able to do a little bit this summer, but how would it look for your organization in the fall?
So I'll start. We don't know yet. So I run an organization that's radically resident driven. We don't do anything without having conversations with our residents and really centering their needs into our program design. So we are right now in our data collection phase. We are having conversations with our residents to really figure out what the needs are and what support is necessary. And then from there, we're trying to pull together partners. We know that we'll continue to do feeding, since we already know that that's a need we have those partnerships in place. And here specifically in Jackson, since we know that kids will not be in school physically into January as of right now. But as far as the other education learning needs, how do we support in that regard? We really are in the learning and trying to figure that out quite swiftly. You know, it's a swift learning because we know time is not on our side, but we are surveying and having one-on-one phone conversations with our residents as we speak, so that we can pull together a plan that works for the majority of them. And I can't say all, because once again, this is not a one-size-fits-all situation. And I cannot act as, you know, as if we have the resources to address all the myriad of needs that are out there right now. If the government can't figure out a response, I will be lying if I said that my small organization could figure out education in 0.2 seconds. But we are doing our part to make sure that we're filling in the gaps. And we are, like I say, we're assessing before we act. So that's how we operate.
Thank you.
Well, the virtual hub actually is what we will be doing in the fall. And so we are working with our districts to bring young people, and parents that have chosen virtual will have an opportunity to bring them into one of the 6 clubs on the coast. And we have staff that will be there. We've extended our morning hours for those that, you know, may work in hospitals or need to go into work early. So we've extended our hours to be from 6 in the morning to 7 in the evening. And so parents can drop their kids off, and we're gonna breakfast, lunch, snack. And then once they're done with their education time, so there'll be a parapro there in the room with them that will help them to log on when they're supposed to log on. You know, we have a backup of headphones and pencils and pens and all that kind of stuff. And in one of our districts, they were not able to get equipment in time. And so we have put some extra computers inside of that particular club, so that if kids don't have Chromebooks, they can, you know, log on with the computers that are there at the club. And so, you know, our biggest group of kids, so that's a small group. Our biggest group of kids is our after school care young people. And, you know, like I said, that's, you know, that's a tough one on us, you know, to be able to figure out. We just could not get all of that figured out. Perhaps we can for a few, for all of the reasons that, you know, we've talked about, those that just need us, you know, because not having kids in school, when one of the things that's important is when schools are open, they are among the agencies that do mandatory reporting of child abuse and neglect. And so, you know, when they're not open, that's one line that's closed, where somebody is not, you know, looking at a child every day and making sure that they're okay. And they may be in homes, you know, with relatives, you know, with things happening that we don't want happening. So that's always on my mind when we're not, you know, with our kids. And so, you know, we're doing what we can for parents, and you know, our parents are really happy, but there's another side, you know, of the work that we do with some parents that, you know, we were not able to support in the way that we normally do. And that's tough. It really is. It's really tough.
Thank you.
Yeah, so, and you know, for us here, there are a lot of ideas that trying to incorporate in the system that's already in place, or what the school district is trying to do. And right now, speaking to the Meridian Public School District, so what they're doing right now is the online, the virtual learning, K through 5. They're using the Google Classroom. The 6 through 12, they're using the Canvas, so that creates the dynamic we just finished talking about, or the challenge with the internet access. And so one of the ideas is to create an internet hub, or a hub around the communities, where those families who don't have adequate internet access, that they can actually get to a surrounding area hub, and have those times split, some time in the morning and time in the afternoon, with some cleaning time in between. So that was something that was discussed with the technology department with the Meridian Public School District. The Meridian Public School District is giving every student a Chromebook. So, you know, I guess I'm making this point because one of the keys here is to to find organizations to help with this virtual piece because it's playing a significant part in the plan for the Meridian Public School District. You know, they have already put in place meals that continue to be delivered. And so, you know, organizations can partner with that. And I think another key, again, I can't say for certain if it's in place, but I do believe that the organizations can play a role in supporting the parents in this whole dynamic. And I'll further that, but, you know, also the educators, but organizations, whether it's churches or, and I have to plug our you know, East Mississippi Boys and Girls Club, you know, do an excellent job with after school care, before school care, and being that external resource. The organizations, whether it's faith organizations that I'm a part of, or the Meridian Lauderdale County and NAACP, right now it's all been about conversations to find out where we fit in what's already in place. I think our doctor sister has already said it. This is a point where we can't necessarily come with answers, but we come to the table with a dialogue and find out where the pieces that we have to this puzzle, where we can place those pieces to help this whole system work effectively.
Yeah, and it's definitely important to remember that we are working daily and being humble and learning and asking questions and asking for help and helping each other. I'm going to take some questions for the chat. So let's see what we have. One viewer asked, if you're in a red zone for COVID-19, do you believe we need to start school year later? Different districts are, you know, starting at different times, making different choices. And this person wants to know that if you're in a red zone, should we start the school year later? What do you think?
Yeah, and that's what the Meridian Public School District made a decision today. The virtual will begin August 10th, and then because we are in the red zone, we are one of the hot seats here in the state, pushing the face-to-face date into September.
And the state is not in the hot zone right now, is what I was wondering. Like, let me look at that map. That whole map is dark red. So
right.
Yeah, I think it would be wise. You know, if you're, you know, we close schools when we have far less. And I think we're gonna be okay if we were to delay to you know, after Labor Day. And, you know, for me, I've been teasing everybody, you know, I don't know, I was born in that time where we went to school after Labor Day anyway. So I'm like, you know, an ode to the past. Let's go back after Labor Day. What is it gonna hurt? You know what I'm saying? You'll be your last, you get to wear white a little longer. You go back and you can't wear white anymore. You know, but let's, you know, I just don't think it will hurt us at all to be able to wait to go back.
Yeah.
Yes, well, thank you all. And, you know, different schools are making different decisions. And as you all have lifted up throughout this dialogue, we have to show each other grace, and it's because it's a tough situation. I'm going to look at another question from the chat. Do you think paraprofessionals should be trained alongside teachers? Going back to what we discussed earlier, you want to just talk about some Dr. Yandoro first?
can you go to somebody else? I got a whole lot going on over here right now.
Reverend Bogger, do you think, I think you mentioned a little bit earlier, paraprofessionals, should they be trained alongside teachers? And that'll take us back to something that was mentioned earlier.
Yeah, I think all hands on deck right now. Again, I keep referencing the school district here that over the summer, teachers, I don't know for certain if paraprofessionals were a part of this, but I do know that teachers were going through a program to learn how to, or to give them equipment or equip them to teach online for this upcoming year. And hopefully paraprofessionals were a part of that. If not, I can't say for certain, but I do think they should. I think that this is a case where, you know, the levels and categories of our education, I think all hands need to be on deck right now to try to figure this thing out so that we can sustain long term.
Yeah, well, I definitely agree. I mean, to your point, all hands on deck, you know, let's, as many as we can train, to be honest with you. I think we should have some in the hopper, you know, this is about planning. It's, you know, it's about, this is, you know, it's just not, it's not that thing, you know, this is, let's get ready, you know, and I think the more that, that's wise for me, you know, so those are that's just wise to be ready and to get everybody ready, you know, get me ready. Let's everybody get ready to teach kids, right?
Yes.
Because we, you know, when you think about what was raised earlier, where teachers, you know, what happens when a teacher is tested positive for COVID,
Right.
you know, and I know there's some limitations with the licensure as it relates to a paraprofessional, but, you know, is there a way around this so that there can be an easy transition until another teacher is able to secure that spot? So again, I definitely think that's something that's wise.
Yeah, absolutely. Absolutely.
Thank you both. Thank you. All right. Do you want to add, Dr. Yandara? Okay. All right. Well, we actually come to the end of our time, and I really want to thank you all. And I just appreciate what you're doing, how you're out here serving, and I really appreciate how you lifted up the importance of us partnering people, you know, working together, because this is an entirely different territory that we're going to have to figure out how to navigate together. So just thank you what you do for children, what you do for the community. And I do want to emphasize, you know, just everyone paying attention, keeping their eyes and ears open to each other and supporting each other. So thank you all again. And I want to say thank you to One Voice and the Mississippi NAACP for sponsoring this. And I do hope, you know, you all can join or tune in, because we do have 2 more in this 3-part series. So thank you all so much. And thank you to everybody who tuned in.
Thank you. Thank you for the opportunity.
Appreciate it. Y'all be safe and stay inside. The streets are hot.
Yes.
Absolutely.
Bye. Thank you.
Take care.
Well, nice.